It's a wide world, and it's only getting wider. Global rates of overweight and obesity have climbed steadily over the past 30 years, and not one country has been able to reverse the trend. I'm Erin White with your latest health news. Several reports in the past few years have declared obesity to be a mounting health crisis. Obesity has been tied to increasing cases of diabetes, stroke, and heart disease. In 2010, about 3.4 million cardiovascular-related deaths were attributed to being obese or overweight. Confirming that the world is undergoing an obesity epidemic, a new study has found that almost one-third of the global population is now obese or overweight. Speak with a doctor about a healthy exercise and diet plan for you.
More women are choosing an aggressive treatment option for a diagnosis of breast cancer, and this trend is rising fastest in a certain group of women. I'm Shelby Cullinan with your latest health news. To track trends in treatment of early-stage breast cancer, a research team reviewed a large database of information to find which type of surgery women chose as their treatment. The results show that when cancer was found in one breast, more young women than in previous years were choosing to have both breasts removed. The authors of the study wrote that the chance of getting cancer in the other breast was only 3% in 5 years and 6% in 10 years. They also explained that these rates have been dropping due to the development of more effective treatments. Ask your oncologist about breast cancer treatment options.
The FDA and the EPA are both updating their advice for pregnant women and children when it comes to eating fish. I'm Rochelle Grossman with your latest health news. Due to concerns over rising levels of mercury in fish, the federal agencies have already established maximum guidelines for the amount of fish to eat, but until now, they haven't recommended a minimum amount. Now, new advice suggests that women who are pregnant, might become pregnant, or who are breastfeeding eat 2 to 3 servings of a variety of fish each week. The agencies also recommend that young children eat 2 to 3 servings of fish since their research shows fish provides a number of health benefits. They do recommend types with lower levels of mercury like salmon, shrimp, pollock, light canned tuna, tilapia, catfish, and cod.
Allergies is an immune system disorder that occurs when the immune system is overly sensitive to certain non-disease-causing substances called allergens. Allergies can be described as a false alarm of the immune system. Allergies can cause a variety of minor symptoms, including runny nose, itching, swelling, or sneezing. However, some severe allergies can cause hives, trigger asthma attacks, or create life-threatening breathing problems. Some common allergens include pollen, pet dander, insect stings, certain food, and certain medication. Family history of allergies, a lack of early childhood exposure to allergens, and young age may increase the risk of developing allergies. Treatments include many over-the-counter antihistamines, including cetirizine, fexofenadine, and loratadine. Prescription steroids, including prednisone and methylprednisolone, have also been used to treat severe allergies. Allergy shots, also known as desensitization therapy, is often effective at preventing allergies. The easiest way to prevent allergies is to simply avoid the offending allergen. Wash hands and clothes thoroughly after touching a known allergen. Know and avoid drug and food allergies and exercise caution whenever there is a chance you may be exposed to serious allergy triggers.
You expect food to nourish you, not to make you ill, but foodborne illness remains a problem in the U.S., as a new study has shown. I'm Shelby calling in with your latest health news. This new study from the CDC looked at preliminary data for 2013 to examine trends in these illnesses during the last year. Salmonella infections, the most common type of foodborne illness, is often transmitted through foods with an animal origin, like meat, milk, or eggs, but any food can become contaminated with bacteria. Whereas Vibrio bacteria are usually transmitted through raw or uncooked seafood. The study found that rates of foodborne illness in the U.S. largely stayed stable in 2013. But while salmonella infections decreased, illnesses caused by the bacteria Vibrio saw a big jump. Make sure your food is cooked and cleaned thoroughly before eating.
Prescription medications are familiar to many people in the United States, but just how common are they and which types of medication are we mainly using? I'm Sonia Singh with your latest health news. A new report by the Centers of Disease Control and Prevention, or CDC, analyzed the use of prescription meds in the U.S. The report showed that during 2007 to 2010, almost half of Americans had used a prescription medication in the past month, and many of these Americans were using said medications for heart-related issues and cholesterol levels. Speak with your doctor to learn more about the appropriate use of prescription medications.
Physical activity and exercise are typically recommended as part of a healthy lifestyle. Yet for some, there may be such thing as too much exercise. I'm Kendra Rowland with your latest health news. Recent studies looked at the relationship between exercise and heart health. Researchers tracked the physical activity habits of patients with heart disease. They found that patients who exercised moderately had the lowest rates of stroke and heart attack compared to inactive and very active patients. Another study found that in men, vigorous exercise at age 30, followed by sedentary habits by age 60, was tied to increased risk of irregular heartbeat. Work with your doctor to find a healthy fitness plan.
Vaccines are designed to protect against disease, but babies cannot get most vaccines until they're 2 months old, leaving them vulnerable. A vaccine during pregnancy may help. I'm Shelby calling in with your latest health news. A recent study found that giving mothers a vaccine against whooping cough during pregnancy increased their baby's protection against the disease after birth. The vaccine is called Tdap, which stands for tetanus, diphtheria, and acellular pertussis. The newborns whose mothers received the Tdap during pregnancy had more antibodies against whooping cough than the babies of mothers who received the Tdap after giving birth. Ask your OBGYN about the Tdap vaccine during pregnancy.
Summertime brings sunshine and warmth, but also mosquitoes and attempts to ward them off. Many people might wonder whether insect repellents with DEET are safe. I'm Erin White with your latest health news. DEET stands for N,N-diethylmetatoluamide, a compound shown to be effective in warding off insects. A recent study found no evidence of negative health side effects related to the use of DEET at the recommended levels. Take steps this season to prevent mosquito bites.
Poor diet can contribute to the risk of developing type 2 diabetes, but which is the right diet to reduce that risk? I'm Shelby calling in with your latest health news. People with type 2 diabetes have high blood sugar because their bodies do not use insulin effectively to reduce the blood sugar levels. Results of a recent study have shown that several healthy diets, including the DASH and Mediterranean diets, can reduce the risk of developing type 2 diabetes. These diets emphasize vegetables, fruits, whole grains, beans, seeds, nuts, and healthy fats, as well as certain types of lean meats, fish, and low-fat dairy products. Ask your doctor how to cut your diabetes risk.
About 1.5 million people around the world are currently on hemodialysis, an artificial blood filtering treatment for kidney failure. This treatment is known to impact patients' physical function, but they may have more control than they realize. I'm Erin White with your latest health news. A recent study found that hemodialysis patients with more muscle mass had better physical function compared to hemodialysis patients with low muscle mass. The researchers suggested that physical activity that builds muscle mass may be associated with better overall health and quality of life for hemodialysis patients. Discuss an appropriate physical activity regimen with your doctor.
For many, using aspirin can be a huge help when it comes to fending off a headache and reducing the risk of a heart attack. However, could aspirin also help lower the risk of a certain type of cancer? I'm Sonia Singh with your latest health news. A new study funded in part by the National Cancer Institute has found that people who carry a particular gene may reduce their risk of colorectal cancer by taking aspirin. The study focused on over 200 colon cancer cases that developed over the course of 3 decades. Although research is ongoing, researchers concluded that doctors could safely take a biopsy from the colon during a colonoscopy to determine which individuals would benefit from a daily low-dose aspirin regimen. Speak with your doctor to learn more about the benefits of aspirin.
Lice are parasitic insects that can sometimes be found on the heads and bodies of certain patients. Lice can cause intense itching and small red bumps on the scalp, neck, and shoulders. In addition, lice eggs or crawling lice may be visible in the hair or on the skin. There are 3 common forms of lice, including head lice, body lice, and pubic lice, sometimes known as crabs. Lice are easily spread through close personal contact and by sharing belongings with people who have lice. Even though lice most typically affect school children, lice can affect people of all ages. Lice are not spread by pets, nor can they hop or fly to new hosts. Both over-the-counter and prescription medications are available to treat cases of lice. Over-the-counter medications like Nix and Rid are available as shampoos, lotions, and rinses. Prescription medication, including Sklice, is available as well for cases that are hard to treat. Keep people with lice away from others until they can be properly treated. Maintain proper hygiene to avoid lice. Always remember to wash all clothes and bed sheets with hot water and detergent if you find someone close to you has had lice, as lice can sometimes survive on household items for long periods of time.
Untreated appendicitis can have serious consequences, but surgery may not be the only option for children with the condition. I'm Erin White with your latest health news. Appendicitis occurs when the appendix becomes inflamed or infected, swollen, and painful. Researchers found that appendicitis was successfully treated with antibiotics in almost all of the children who were treated with them. This treatment meant kids could return to school sooner and felt better than the children whose appendicitis was treated with surgery. Speak with a doctor about the risks and benefits of different treatment options.
Many people drink caffeinated drinks like coffee or tea on a daily basis. It's possible that even small changes in coffee consumption could affect their health in a major way. I'm Shelby Cullinan with your latest health news. A recent study found that people who increased their coffee consumption by more than 1 cup per day over a 4-year period were 11% less likely to develop type 2 diabetes in the following 4-year period compared to people who did not change their average coffee consumption. The findings reveal that these increases and decreases in type 2 diabetes risk were only associated with caffeinated coffee. Discuss your daily coffee consumption with a doctor.
For those with chronic high blood pressure, keeping healthy is essential. Exercising and maintaining a healthy diet can delay or prevent diabetes. These interventions can even save lives. I'm Sonia Singh with your latest health news. Prediabetes is constantly high blood sugar that isn't quite high enough to qualify as diabetes. A study was conducted with patients who have this condition, some of which were assigned to a diet or exercise intervention, while others received standard medical treatment. Following up 20 years later, the intervention group had significantly lower rates of death from all causes and from heart disease, as well as lower rates of diabetes. Speak to your doctor about diabetes prevention and treatment.
Osteoarthritis is the most common form of arthritis that results from a breakdown of cartilage around the joints. Healthy cartilage usually absorbs the shock of movement and activity, but when cartilage is lost, the bones are able to grind against each other. This can occur in any joint, but usually occurs in the hands, knees, hips, or spine. As osteoarthritis worsens, it can cause pain, swelling, and reduced motion in the joints. Over time, osteoarthritis can cause permanent damage to the bone and even make walking and other daily activities difficult. Osteoarthritis usually happens gradually over time. Some risk factors that might lead to osteoarthritis: being overweight, getting older, joint injury, joints that are not properly formed, a genetic defect in joint cartilage, stresses on the joints from certain jobs, and playing sports. Osteoarthritis occurs most often in older people. Younger people sometimes get osteoarthritis primarily from joint injuries. Doctors often combine treatments to fit a patient's needs, lifestyle, and health. Treatment may include exercise, weight control, rest and joint care, non-drug pain relief techniques to control pain, and even surgery. Medications include acetaminophen and NSAIDs such as ibuprofen. Lifestyle changes, including weight loss, gentle exercise, and hot and cold packs, can help reduce pain and sometimes slow down the progress of osteoarthritis. Some supplements containing glucosamine and chondroitin may also help with joint health.
Exercise is key to losing weight and keeping that weight off, which is healthy for the heart. But even without weight loss, physical activity may provide quite a bit of benefit. I'm Rochelle Grossman with your latest health news. A new study showed that for otherwise healthy middle-aged women who were overweight or obese, physical activity was the only lifestyle factor that protected against becoming at risk for heart disease. The study's findings suggested that physical activity may help prevent overweight women from developing chronic heart diseases, even if they have been previously diagnosed with risk factors for the disease. Speak with a doctor about a healthy weight loss plan for you.
While it's true that childhood obesity is a complex problem influenced by many factors, the key to combating this problem may lie in 3 simple rules of thumb. I'm Erin White with your latest health news. A recently published paper cited the 3 rules as eating a mostly plant-based food diet, being more active, and turning off media. It concluded that by replacing noise, processed foods, and physical inactivity with silence, minimally processed foods, and physical activity, parents and children can lead healthier lives. Make sure to eat healthy, get moving, and limit your family's media intake.
A woman experiences a variety of changes to her body while she's pregnant. While these are normal changes, they might influence her alertness or the way she's feeling occasionally. I'm Shelby Cullinan with your latest health news. If any person is feeling tired, nauseated, or otherwise not well, it may increase their risk of an accident while driving. A recent study found that pregnant women who may feel fatigue or nausea more often than usual had a higher risk of a car accident while driving in their 2nd trimester compared to their risk while not pregnant. Be alert and follow traffic laws while driving.
Taking prenatal vitamins is important for pregnant and breastfeeding women, but even these supplements may not give women enough of one crucial substance. I'm Kendra Rowland with your latest health news. A recent statement reviewed the importance of adequate iodine intake for pregnant and breastfeeding mothers. Many women do not get enough iodine, which can be found in yogurt, milk, iodized salt, shrimp, lobster, and other foods. Doctors recommend that pregnant and breastfeeding women take daily supplements of at least 150 micrograms of iodide. Ask your OB/GYN about taking iodine supplements.
Here's another reason to make whole grains and vegetables a part of your diet. Getting enough dietary fiber may be a life-changing health decision for people who've had a heart attack. I'm Erin White with your latest health news. Fiber is commonly found in vegetables, fruits, beans, legumes, and whole grains. Recent research looked at the link between dietary fiber consumption and death in people who had previously had a heart attack. The researchers found that participants who ate the most fiber had better survival odds than those who ate the least. They noted that dietary fiber from cereals provided the strongest protection against death. Get your daily recommended amount of dietary fiber.
Asthma affects millions of children in the U.S., making it the most common chronic condition among children. And the air around the homes of some children with asthma may be affecting their condition. I'm Shelby Cullinan with your latest health news. A recent study found that traffic-related air pollution was tied to increased odds of white children being readmitted to the hospital for asthma within 12 months of initially being hospitalized for the same condition. Air pollution exposure and hospital readmission were not significantly linked for African American children. The findings suggest that other social and environmental factors not considered in this study came into play. Speak to a pediatrician if you live in a high-traffic area.
Consuming lots of sugary drinks can expand your waistline, but you may not be aware of what it also might do to your blood pressure. I'm Erin White with your latest health news. Sugar is added to many food products, but the largest source of added sugar we consume is in sugar-sweetened drinks. Drinking sugar-sweetened beverages has been linked to obesity, high blood sugar, heart disease, and kidney stones. Recently published research found it was also associated with increased blood pressure and a greater risk for developing hypertension. The studies that researchers analyzed showed a 26 to 70% increased risk of developing high blood pressure in people who consumed sugar-sweetened beverages compared to people who did not drink sugar-sweetened beverages. Speak with a doctor about healthy blood pressure levels and limit your consumption of sugar-sweetened beverages.
Hypertension, or otherwise known as high blood pressure, is a condition identified by blood pressure that rises and stays higher than what is normal. High blood pressure often has no immediate noticeable signs or symptoms, but very high blood pressure can cause headaches, vision problems, and even damage certain organs. Hypertension that lasts for a long time can cause kidney damage, heart damage, and increase the risk of a stroke. Obese patients, older patients, smokers, diabetics, and patients with poor diets or a family history of high blood pressure are at a high risk of having high blood pressure. Alcohol abuse and illegal drug use can also cause blood pressure to rise. High blood pressure can be treated through healthy lifestyle changes such as diet and exercise, but in many cases, medications can help safely and effectively adjust blood pressure back to normal levels. ACE inhibitors such as lisinopril and diuretics such as hydrochlorothiazide are commonly used to treat high blood pressure. A wide variety of blood pressure medications are useful in different situations to treat hypertension when other medications fail. Preventing and managing hypertension is important to living a healthy life. Maintain an active lifestyle with plenty of exercise and avoid excessive salt intake in your diet. If you have a family history of hypertension or other major risk factors, take the time to monitor your blood pressure periodically.
Drinking alcohol or smoking has been shown to increase the risk for esophageal cancer, and enjoying the two vices together might raise that cancer risk even further. I'm Shelby Cullinan with your latest health news. Esophageal cancer is cancer of the tube that carries food and drink to the stomach. While the combined effect of drinking alcohol and smoking increased the chance of developing esophageal cancer, researchers reported that when the two habits were taken together, the cancer risk was greater than having either habit on its own. The researchers recommended that the intake of alcohol and the use of tobacco be reduced as much as possible. Tell your doctor if you drink alcohol or smoke.
COPD causes difficult breathing, which can lead to anxiety and insomnia. A new study says a common type of medication used to ease these symptoms may not be the best option for those with COPD. I'm Erin White with your latest health news. This new study showed a significant increase in the risk of COPD patients having a severe respiratory event, such as shortness of breath or fits of coughing, when prescribed a benzodiazepine medication. Study data showed that COPD patients who used benzodiazepines were 45% more likely to experience respiratory-related side effects than the group not taking benzodiazepines, as well as 92% more likely than the benzodiazepine-free group to require emergency room treatment caused by increased severity of their COPD symptoms or the development of pneumonia. Speak with the doctor about your COPD symptoms and medication that is safe and effective for your condition.
Diabetes is a condition where blood sugar levels remain higher than normal. There are two main types of diabetes. In type 1 diabetes, the body attacks cells that normally produce insulin. In type 2 diabetes, the body does not make or use insulin the way it should. Insulin is a hormone that helps the body use sugar for energy. In diabetes, problems with insulin causes sugar to stay in the blood. Another form of diabetes that mainly affects pregnant women is known as gestational diabetes. Symptoms of diabetes include increased thirst, frequent urination, fatigue, blurred vision, frequent infections. Age, family history, race, diet, and lack of exercise may increase the risk of developing diabetes. Over time, having too much glucose in the blood can cause damage to the eyes, kidneys, and nerves. Diabetes is also a risk factor for many other conditions, including infection, heart disease, and liver problems. There are many different medications that can help treat diabetes. Oral anti-diabetic medications like metformin and glipizide are effective in keeping blood sugars in check, and injectable insulins are often used to help the body use blood sugars normally again. Eating a healthy diet, maintaining a healthy weight, and exercising can help control diabetes. It's important for diabetics to routinely check their blood sugars. Take medications on time and get regular checkups to watch out for complications.
The risks of smoking can extend beyond your own health and that of the individuals breathing the secondhand smoke. They may extend to your children's choices as well. I'm Shelby Cullinan with your latest health news. A recent study found that teens were increasingly more likely to smoke with each extra year their parents smoked since the kids were born. Even if the teens were not regular smokers, they were more likely to experiment early on with smoking for each additional year their parents lit up. Quit smoking before having kids.
If you have allergies, you know your symptoms can change during the day. And based on new research, there might be a pattern to when your pollen allergies are at their worst. I'm Rochelle Grossman with your latest health news. A team in Denmark found there may be specific times when allergy sufferers should stay indoors, and those times change. The research found the early season displayed two peaks, in the morning and evening. The mid-season pollen count spiked once in the evening, and the late season peak came in the late morning into early afternoon. Keep up with your local pollen count forecast to work with the change in peak hours and talk to your doctor about managing seasonal allergies.
E-cigarettes have become a popular fad among smokers and have often been used as a substitute for regular cigarettes. Yet the debate surrounding them has grown, and now rules governing the products may become stricter. I'm Kendra Rowland with your latest health news. The FDA has proposed that e-cigarettes and other tobacco products would fall under their regulation. The FDA currently regulates certain tobacco products, including cigarettes, roll-your-own tobacco, and smokeless tobacco, but not others. The proposed change would extend this regulatory authority to include additional products. The rules would require e-cigarettes to include health warnings and only make health claims confirmed by the FDA. Speak with your doctor about healthy ways to quit smoking.
Celiac disease is not common among children, but it may have been underdiagnosed until recent years. Knowing risk factors for it may help parents. I'm Shelby Cullinan with your latest health news. A recent study was conducted of nearly 1,000 children in Italy who were assessed for stomach problems. The children were classified as having either irritable bowel syndrome, abdominal pain, or upset stomach indigestion. The study found that children with irritable bowel syndrome are 4 times more likely to have celiac disease than children without irritable bowel syndrome. These findings mean that parents of children with irritable bowel syndrome may want to ask about screening for celiac disease. Ask your pediatrician about celiac disease screening.